Getting a new diagnosis of atrial fibrillation can be scary and a bit overwhelming. And I got to tell you, with all the smartwatches out there now, we're seeing atrial fibrillation more and more and more. Dr. Lacey and I really just wanted to give people out there a resource and help build a roadmap so that you can live with your atrial fibrillation and do well. Today on Living Heart Smart.
Hi, everybody. Welcome back to another episode of Living Heart Smart. I don't know about you, Matt, but I am definitely seeing in my office more and more somebody coming in saying my smartwatch told me that I have atrial fibrillation. It's common.
Oh, for sure. Yeah, no, it's great, but it can lead to some stress.
So if you're coming into the office and you just have had an alert on your smartwatch, and this is the first way that you've ever been introduced to the term atrial fibrillation, let's start putting this into perspective, right? Because a smartwatch isn't meant to be used for a diagnosis. So just because your smartwatch gave you an alert doesn't necessarily mean you carry a diagnosis of atrial fibrillation. The smartwatches are really considered they're like a screening tool, right? Yeah. So it's sort of like having a smoke detector in your house. So the smoke detector goes off and it alerts you, hey, there might be something going on. You should check this out.
Yes, you never want to ignore that, right?
Same sort of way.
Yeah.
So when you do get these alerts on your smartwatch, first thing, don't panic, right? Yeah. There's like a couple of extremes that we want to avoid you from going to. First thing, don't panic. Don't get worried. Don't drop everything and run necessarily. And the other thing, though, is don't ignore it either. So somewhere in the middle is how we want you to take care of these alerts that you're getting from your smartwatch.
Yeah, that's true. I think the most important thing there is if you're getting symptoms like heart racing, shortness of breath, or chest pain, along with your smartwatch saying you have atrial fibrillation, that is something that needs to be dealt with now. But if it's just showing you that maybe you're having some atrial fibrillation, then you just need to make sure that you connect with your doctor sooner rather than later.
Right, sooner rather than later. So we've talked about these alerts that you may be getting from your phone, but let's take a first step back. What is atrial fibrillation? What are we talking about? What do you tell patients?
Yeah, well, atrial fibrillation is a heart rhythm problem. There's an electrical system in your heart, so this is an issue that has to do with the electrical components of the heart. And what's happening is the upper chamber of the heart, the atrium, are firing very rapidly and chaotically. That's the fibrillation part. And what happens when the upper chambers are firing very rapidly and irregularly, that's also telling the lower chambers of the heart to beat fast and irregularly, and people often feel that with palpitations. So there's two big concerns there. Number one is this chaotic beating in the upper chambers could lead to clots forming inside the heart, which could lead to strokes. And number two, a fast heart rate over time can lead to problems as well.
You were doing a lot of hand motions there, Matt.
Oh, was I? I didn't recognize. Well,
do you do hand motions in the
I
office?
guess. I mean, when I think about atrial fibrillation and the upper chambers and lower chambers, I guess I just automatically go into.
I do hand motions too. So the way I do it, I have the top chamber, bottom chamber, and they're usually coordinated. But with atrial fibrillation, the top chamber is just going nutso, and it comes down to the bottom chamber really erratically. Those are my hand motions.
Those are good. Yeah.
I don't know if they help or not, but I do them.
That does. That helps.
When we're talking about atrial fibrillation, Matt, you touched on two really big important problems with atrial fibrillation that we think about in the office. And the first thing is stroke. What is risk of stroke? Because of that crazy going like this in the top chamber of the heart and the blood flows. What's that?
The fibrillating part.
The fibrillating part, yeah. The chaotic activity in the top chamber of the heart, the fibrillation, that doesn't allow the blood flow as normally through the heart as it could, and that can lead to clot, which clots can then cause stroke, and that's a major problem with atrial fibrillation. The other part that you said is the heart rate likes to go too fast, and that can lead to heart failure. Those are things that we're going to address fairly quickly when you come into the office, but really these are manageable problems. So one thing patients ask me all the time, what can I do? What can I do right now to help reduce the atrial fibrillation?
Absolutely. And I think there are so many things that patients can take control of right away that will help in the long term manage their AFib. May not make it go away completely. It's probably going to be some give and take between medications, but there are certainly some things everybody should be thinking about to help manage their AFib themselves.
Right. And not only just help managing it in the short term, this actually helps manage your AFib better for you for the longer term too. So the first thing that I start telling patients, things that we know help. If you are overweight, working on losing weight is really a good step in the right direction to help manage your atrial fibrillation. We know that being overweight or obese and atrial fibrillation, they go hand in hand with each other.
Yeah, I think the two big things I think of is increasing age, which you can't control, increases your risk of atrial fibrillation.
Yay.
But secondarily, obesity or being overweight certainly does it too. And this is not new data. We just haven't pushed it as much as I think we should have been in the past about how patients can help themselves by getting their weight down to control their atrial fibrillation. That's a big part of it. And losing the weight does matter. It does help. It does make a huge difference. So number one, look at the scale and decide what you can do to start bringing that weight down. Good for many other reasons, including your blood pressure and blood sugar and all those sort of things, but particularly for AFib, very helpful.
The next thing, this one, people don't like this one, but one of the next things that you really need to consider is alcohol use.
Yeah.
This is a hard one for people to wrap their head around at times. There's more sustained effects in our bodies or longer effects in our bodies than after the alcohol is metabolized out of our bodies. So that is one of those things that you really need to work on, reducing alcohol intake.
As we have said here before, when it comes to alcohol, less is better and none is best.
Yep.
And for people with atrial fibrillation, I think you just want to take that out of the equation, because it's almost impossible for us to tell you AFib is 100% from drinking alcohol, but it is one of those factors, additional factors that is mixing in that atrial fibrillation tends to go hand in hand with.
Mm-hmm. Another thing we often start looking at is sleep apnea, and sleep apnea has really increased in the amount of diagnoses that we've seen over the years.
Many of those people also are overweight, so then you've got too much weight plus the sleep apnea contributing to atrial fibrillation. So those things go hand in hand.
And treatment of sleep apnea helps reduce episodes of atrial fibrillation as time goes on.
Yeah, data is very strong.
Using a CPAP machine. And then exercise. What I tell patients they should exercise. There's almost nothing I tell patients that they shouldn't exercise for. Very few things.
Yes, I think, well, the concern people get is, can I exercise while I have atrial fibrillation? Is that going to hurt me in some way?
Yep.
And the answer is no. You need to listen to your body. So listen to your body and be smart about it. But exercise in general is going to be a healthy way for you to deal with atrial fibrillation for sure.
Do you have patients ask you about if there's such a thing as too much exercise? I've had that occasionally where people say, "Oh, I can't exercise because atrial fibrillation will cause more AFib."
Yeah.
Thankfully, I don't get that question a whole lot.
Oh, I get the question.
There's not. There's
There
no
is
good data.
some data that extreme athletes who are, marathon runners or super long distance runners, there may be some associated potentially bad cardiovascular things, atrial fibrillation being one of them. But that's such a super small amount of the people we're talking about that deal with AFib that I don't worry about it.
Yeah, I don't worry about that either. And finally, stress. Everybody asks me, "Oh, I'm stressed out." It must be the stress that's causing it, right?
Stress is a tough one to put into perspective because there's just a lot of stress in general.
Right.
But I do think it is part of the pie, because when you're stressed, you're not exercising as much, you may be eating the wrong foods, you may be drinking too much alcohol, you may not be sleeping as well. So it is one of those factors that is part of the bigger picture of atrial fibrillation and your health in general. But how we put that in perspective to stress alone with AFib is difficult. But it plays a role, sure.
So I think what you're trying to say really is it's important for people to learn stress management techniques, because we can't make stress go away. It's always going to be there. But learning techniques that are more adaptive and better for our health. So going outside, getting that walk, doing some yoga or meditation. Those are all ideas that people can use to help manage their stress better, which then may help improve their atrial fibrillation symptoms that they're having.
We're back to moderate intensity exercise, decreases depression, decreases stress, improves sleep, all those things. So always start there.
Exercise is the best pill that we have.
It is. Yeah.
It is.
The last thing to chat about here, I think, about what people can do for themselves when it comes to treating atrial fibrillation or helping manage it over time is looking at your other health conditions like high blood pressure, diabetes, the thyroid disease, because we're going to be managing those as well to give your heart the best chance it can to stay in a normal.
We've spent some time talking about the things that you can do, and there are a lot of things that you can do. The reality is you're probably going to need to do it in combination with some medications, because the things that we've talked about, trying to prevent stroke, trying to prevent heart failure from atrial fibrillation, oftentimes really requires some medications.
Yeah.
So I usually think about stroke first. I don't know about you, Matt. Let's
I
get
think
stroke
we
out of
have
the
to,
way.
because once
Yeah,
we've limited the stroke risk as best we can with
right.
medications, then we've got time for everything else. Rate controlling, helping with the symptoms,
Yep.
long-term planning. Well, once we control for stroke, everything else comes later.
That's how I think about it too.
Yep.
And when we're talking about how do we reduce that risk of stroke, we're talking about blood thinner medications. And we're
Yeah.
talking about using blood thinner medications consistently on a daily basis. That's how we reduce your risk of stroke. And the reality is that most people are going to end up on a blood thinner at some point.
Yeah, that's for
Yeah.
sure. And something above and beyond aspirin, because a lot of people know that
Yes.
aspirin alone is a blood thinner. But for atrial fibrillation stroke prevention, typically we're going to be using another type of blood thinner, thin your blood in a little different way to help prevent that clot forming in your heart, which ultimately could go upstream.
And you've seen these blood thinners that have been advertised on television. Eliquis, Xarelto, these are some of the common drugs that you're going to be seeing. These are the medications that we're using. But how do we decide who are the appropriate people for blood thinners? And so this really comes down to looking at your medical history, your age, do you have high blood pressure, have you had diabetes? And these are some examples. And as we are coming up with this sort of checklist, if you will, that's how we decide, that's how we make the decision.
Yeah, this isn't guesswork. It's very
Right.
well thought out. This is something called the CHADS VAS score. It's looking at the risk factors, your age, other things going on in your body to help determine what your risk is specifically for stroke. And that helps decide whether or not you would be better off with a blood thinner.
With a blood thinner.
Yeah.
Right. Right. And then after that, we can take a breather.
Yeah, you can
Okay, what
rest
do
a
we
little
need
bit
to do
easier.
now?
You're gonna be fine. And then we come in with other medications, mainly to help control your heart rate. Most people need something to slow down the heart rate.
Mhm.
There's a couple of different classes of medications that can help us with that. And then for some people, there's a different class of medicine called antiarrhythmic drugs, which help control the rhythm.
And as we talk about that, Matt, it really goes to show that not everybody's AFib is the same. How did you
Oh my
describe
gosh.
it? How did you describe it?
Well, with atrial fibrillation, there is no one shoe that fits everybody, right? This is a
Right.
widely variable
That's
problem.
it.
It depends
Yes.
on if you're 35 years old with your first episode of AFib versus 85. Depends on what your heart condition is like. Depends on the structure and function of your heart. Depends on what other medications you're on. So it's a huge spectrum. It'd be so nice if there were just one way to treat AFib, but there's not. So it
There's not.
often involves a lot of give and take, some testing, some trials of medication, some back and forth. So it takes some work. It's going to take some effort, but if you're consistent with it, we'll find the sweet spot for you.
And then it will change, and then we'll do it all again because
Sweet spot
that's
number two, and then number
sweet
three.
spot
Yes,
number
that's right.
next, right? We just keep going until
Yeah.
we found the sweet spot.
It's a big part of what we do now, and so we've kind of got it down. This roadmap that we're talking about for you, we follow roadmap as well, which is going to be to decide on what medicines ultimately you're going to need to control your rhythm.
Right. So after you've been diagnosed, we're going to do some testing as well. In the background, you're doing the things you can do. We've
Yeah.
worked on some medications. Okay, now we need to get a little bit more testing done of your heart. Let's look and see what your heart looks like.
Yeah, we need to know the structure
Yeah.
and function of the
Yeah.
heart. And we needed to get some basic blood tests done to look at some electrolytes, to look at your thyroid levels, those sort of things.
Thyroid.
So we'll do an echocardiogram, which is an ultrasound of your heart to look at the structure, the function of the heart, the size of your chambers, look and see if you have any valve structure problems. Because sometimes there is a structural problem with the heart itself that could be contributing to atrial fibrillation. So we'll need to figure that out as well. And it really helps direct us with your treatment and next best steps.
We're probably also going to do some monitoring that your doctor has prescribed for you that you're going to wear for a period of time so I can get an understanding of what's happening with their atrial fibrillation. Are they having it a lot? Or are they not having it? And now we can come back to that smartwatch. You know, that smartwatch that gave you the alert early on?
Right.
Now let's use that as a tool that we can use to understand more about your atrial fibrillation.
Yeah, I like that because it does provide some valuable clues as to how we're controlling your heart rate, your heart rhythm, and those sort of things. And it also helps me tie in whether or not patients are having symptoms that are related to an abnormal rhythm or fast rhythm or something totally different. So I think used in the right way, home monitoring with the smartwatch and other new devices is very useful from our standpoint.
Right. You started talking about some procedures. That's probably beyond the scope of what we're going to talk about today. Do you think?
So
There's so
I
many
think,
now.
yeah, well, if we want to do procedures for atrial fibrillation justice, I think it's going to require a separate episode, which
Yeah.
I'd love to do. Procedures that you may hear about associated with atrial fibrillation include cardioversion, which is giving the heart a zap or an electrical shock to get it back into normal rhythm. That's often part of the atrial fibrillation journey. And then longer term things include atrial fibrillation ablation, and then potentially left atrial appendage closure for those that have high risk for bleeding with atrial fibrillation. But another episode for those, please.
Yes. Matt, people really need to hear that there's some reassurance with atrial fibrillation.
I think so. Yeah.
think so.
Yeah, I mean, that's got to be
Yeah.
the biggest thing we do, hopefully today, is grab people by the hand and say, you're going to be fine. We just have,
Right.
it's going to take some work to get there.
It's really very, very common. Millions of people walk around every day with atrial fibrillation or deal with it in some way, shape, or form, and they're living normal lives. They're doing the things that they want to do. They feel well, even with their atrial fibrillation. So it's really a very common problem.
About 10% of people over the age of 80 have atrial fibrillation. AFib is everywhere, and I think people do well with it. It's just a matter of making sure we check all those boxes as we go forward.
We've given you a lot of information today. We've talked about what is atrial fibrillation, and we've talked about how to manage your atrial fibrillation, and it's going to be managing from a lot of different directions. So the first things we talked about were lifestyle things you can do. Work on weight loss, exercise, reduce alcohol, get tested and treated for sleep apnea, work on your stress. We've talked about medications that we're going to use, like blood thinner medications to reduce stroke, and how to use medications to improve or control your symptoms. We've talked about testing that you're probably going to have done, looking at your heart with an echocardiogram, some monitoring, some blood work. We've also talked a little bit about some procedures that may be in your path. And hopefully we've just given you some reassurance that this is manageable.
Yeah. And I think the key is a lot of these things are going on at once. Even though we laid it out a roadmap like this, we're oftentimes doing many of these things at the same time. Everybody's roadmap with atrial fibrillation is going to be a little bit different, but make sure you understand all the variables, work closely with your doctor and your team about getting these things controlled, and you're going to do just fine.
Thanks for listening to us today. We really hope we've given you some good information to use. Tell your friends after they've been diagnosed with atrial fibrillation, tell them to listen to this podcast too. We love that we love your feedback. Let us know other things that you're interested in listening to. Thanks for listening to Living Heart Smart today.
Thank you. Bye-bye.